I'm honored to be a part of this virtual march to stand up for our great American veterans. My father was a veteran of World War I. My older brother fought in World War II, and my younger brother served during the Vietnam era. So I have a personal admiration for those who have served our country. I also feel strongly about keeping faith with our veterans. Each new conflict results in new veterans with new kinds of challenges. Unfortunately, our care and support systems are often slow to adapt to the changing needs of our veterans. The signature wound of Iraq and Afghanistan is traumatic brain injury. Better equipment and medical treatment is saving lives, but leaving survivors with new kinds of wounds that are less visible. PTSD also continues to be a problem. In both cases, we have a challenge to ensure the ability and capacity to treat these wounds and to recognize the symptoms and get help to veterans who need it. Failure to do so can sometimes result in tragedy. That was the case with Joshua Omvig from Grundy Center, Iowa. That's why Senator Harkin and I worked together to enact the Joshua Omvig Veteran Suicide Prevention Act. I'm also co-sponsoring a bill to provide training and funding to family members who provide full-time care to injured veterans. I did so based on the hearing from an Iowa woman who had to quit her job to care for her husband who suffers from a severe brain injury that he received in combat. I intervened on behalf of another Iowan serving in the Marine Corps who was facing a misconduct separation despite the fact that untreated PTSD was the root of his problem. As a result, I'm working to advance legislation that would protect service members with PTSD or traumatic brain injury from being discharged unfairly and thus losing benefits. I also joined Senator Bond in introducing the Honor Act to correct the number of deficiencies in how we care for veterans with PTSD or traumatic brain injury. I've heard from many veterans about the importance of sufficient, reliable funding for the VA healthcare system. That's why I'm a co-sponsor of legislation supported by the DAV to assure timely funding for veterans' health care. As an elected official, I need to know what's working and what isn't working. That's why I value the input that I get from Iowa veterans, and I appreciate the efforts of the DAV to help veterans communicate with members of Congress.